If you have ED, erectile dysfunction, you're far from alone. About 30 million American men suffer from ED. 30 million men who've lost an important part of their lives. 30 million men who've lost a vital connection with their wives or partners. ED may involve a total or an inconsistent ability to achieve an erection. It can happen to any man at any age and has many causes. Chronic diseases such as diabetes, hypertension, heart disease, depression. Certain kinds of injuries or surgeries, such as treatment for prostate cancer, substance abuse or lifestyle stresses. ED is a vascular disease, a condition of the blood vessels.
You know, anything that impacts the vascular system of men, anything that decreases blood flow, such as high cholesterol, diabetes, hypertension, tobacco smoking, are the main causes of vascular obstruction of blood flow to the penis. We also have any type of surgery that impairs either the nerves or the blood vessels in the pelvic area, such as prostate cancer surgery, colon cancer surgery, bladder cancer surgery, radiation therapy will affect the tissues in that area.
My story starts back in about 1972 when I was diagnosed with high blood pressure. They tried various things to find out why I had high blood pressure, and they never did. It was about early 90s when one night my wife and I were in bed and I couldn't perform.
At the age of approximately 30, I was diagnosed as a type 2 diabetic, and probably within the next 2 or 3 years I've developed an erectile dysfunction. So ED has kind of consumed my life for the last 11 years. I could not have any intercourse with my wife, so the tension in the marriage started to get worse and worse.
Therapy for ED covers a range of options. Your physician may begin conservatively by suggesting lifestyle changes. You may try to stop smoking, stop or limit alcohol consumption, adopt a healthier diet, exercise regularly. Medical interventions typically start with oral therapy, involving well-known drugs like Viagra, Cialis, or Levitra. Other possibilities include penile injections, intraurethral suppositories, vacuum erection devices, and penile implants. Men with ED tend to follow different therapeutic paths over different periods of time, depending on different factors in their lives. More conservative therapies may not always work. Some patients may quickly choose an implant, while other patients may take years to consider this alternative.
When I had my prostate cancer, that's what caused me to need the implant. And when I had my prostate cancer, as soon as my urologist gave me the go-ahead to consider the implant, I started looking at it right away. And some patients asked me, well, why would you do that with that chance that you might not ever have a natural erection? And I rationalized my decision to get the implant with the thinking that I'm already in a situation where I have erectile dysfunction. And with having had prostate cancer and having had a radical prostatectomy, the chance of me ever having a natural erection again is slim to none. So I really have nothing to lose. It only makes sense. With the implant, I have everything to gain and nothing to lose.
It was 8 years before I even started anything, and Viagra is what started it. And then, of course, I went through the Viagra and on up injections and all. And that took another 4 years before I got an implant.
I went through all the pills, therapies, and nothing seemed to work. So myself and my wife kind of left it off to the side until it got to a point where it really affected our marriage and how we were getting along.
My lifestyle is very active, and to me, this is really the only way to go. You eliminate all the hassle, the aggravation factor of having to take the pills or the shot or the vacuum pump. This is a one-time fix and forget. You get the implant, it's with you for life, it becomes a part of you.
Now, my brother is a surgeon, and I told him my situation, and I says, I'm considering an implant. And the first question he asked was, which one? Meaning either the rod or the inflatable. And I says, the inflatable. And he says, good choice. He says, I put them in, I know they work. And I said, well, that makes up my mind.
So I went to the seminar and spoke and listened to a patient educator who kind of enlightened me on the pros for the Coloplast Titan, and I sat down and listened to him talk and listened to the confidence that he got from this device that he's had for a few years, and sat down and made an appointment to see the specialist about getting one.
As with any surgery, having a penile implant comes with certain risks: infection, erosion of tissue next to the implant, chronic pain, or device malfunction. Some postoperative discomfort is not uncommon. Typically, however, recoveries are relatively easy.
I remember being quite sore for 2 or 3 or 4 days afterwards. By the end of the first week, the soreness was mostly gone. I took extra strength Tylenol 1 a day or 2 a day, and that was sufficient for me. I understand it'll vary with different people.
Yes,
the pain threshold, it has a lot to do with it.
I keep saying it's the easiest operation I ever had. Yeah. When I left the hospital, there was no pain. I got home, and basically the only thing I had to do was sit down very carefully. Yeah. And I didn't really have the mission. I didn't require any medication. Yeah. And I didn't really have any problem, huh?
Well, I was in pain for a few weeks. Yeah, I had to take the medication. As time went on, it didn't, but it was a little uncomfortable, sure. Yeah. You know, most of the time felt better sitting down than anything else. Yeah. I was very afraid to have surgery. And looking back on it, I should have not even been afraid, because I should have did this a long time ago, due to the fact that I just refused to have surgery, where this was the perfect device to cure my ED. Mm.
Before I had any operation, I was afraid to start something I couldn't finish. And I knew I couldn't finish, so we tended to drift a little apart. There was no touching, no intimacy, there's no the hugs and the kisses. After we got back on track again, it's like we were newlyweds again. We were able to have sex, and then the touching, the hugging and kissing. Now, every morning we have our morning kiss. And it's been a wonderful enhancement to our marriage. In fact, I would say it saved our marriage.
It works pretty much like my penis, like it used to work before, except I get a little help from the implant. You know, it brought me back to being a man, to being able to satisfy myself and my wife at the same time, where we can be together as one.
Both she and I are completely happy, completely satisfied. I know that we had drifted apart a bit after having had the erectile dysfunction. We had drifted apart a bit emotionally, but once I got the implant and we resumed our normal, healthy, happy sex life, that we got closer again the way we had been earlier. So I really feel fortunate to have gotten this implant, because it restored to us both our sex life and our emotional intimacy.
The take-home message is that a man with a penile implant feels normal. Allows for spontaneous sexual activity, enables a man to respond sexually according to his partner. So whenever the partner wants to have sex, he can produce an erection right away without having to wait an hour, without having to excuse himself and do a penile injection.
If you feel you're a candidate for a penile implant, you can begin by taking your web browser to straighttalk.net. Here you can learn more about ED, take an ED quiz, and find out about free patient seminars that take place around the country. Most insurance plans do cover penile implant procedures, including Medicare in most cases. If you have questions or concerns about insurance, reimbursement specialist at your doctor's office can help to confirm your coverage. If lifestyle changes, drugs, and other ED therapies haven't worked for you, it may be time to take the next step. Speak to your physician about what steps you can take to begin your journey back to intimacy.